Hello and welcome to our special show. Every life is invaluable and precious. Medical emergencies like cardiac arrest are becoming far too common. You can help someone in a medical emergency only when you are clear as to what is to be done in such a situation. If you are aware and informed, then you can take steps to revive a person and save their life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Now, raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It is even more important to learn about CPR if you have a loved one who has a history of cardiac diseases, as research reports that the majority of cardiac arrests actually occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained in giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have with us Dr. Ashok Seth, who is among the best interventional cardiologists in India. He is the chairman of Fortis Escorts Heart Institute in New Delhi. In fact, the government of India in 2003 awarded him the civilian honor of Padma Shri, and in 2005 he received IMA NDB Lifetime Achievement Award as well. Thanks very much, Doctor, for joining us. We also have Dr. Suhas Hardas, who is practicing as a consultant interventional cardiologist at Hardas Heart Care in Pune. Dr. Hardas leaves no stone unturned when it comes to raising awareness about CPR. With a vision to empower people to save lives, he came up with the idea of Vardhan, a voluntary CPR training program which is open to all. Over the past 10 years, he has been very active in raising awareness and training people in CPR. Recently, he has also launched an awareness program, Give Away, to bring awareness among the masses regarding the appropriate manner to give way to an ambulance stuck in traffic, because even a few minutes can cause an impact on a life. Thanks very much, doctors, for joining us on this show. And my first question to you, Dr. Seth, despite advancements in prevention and treatment, sudden cardiac deaths remain a leading cause of mortality. So what is a sudden cardiac death?
When a death occurs unexpectedly and rapidly within the onset of a symptom, usually from cardiac causes, that's sudden cardiac death. So it's almost like a person collapsing while at one stage he's okay. And then he says, I feel something and I'm not feeling good. And then suddenly collapses on the floor and is not breathing. That's sudden cardiac death. Now, it's usually a cardiac arrest which happens. I mean, scientifically, we could say that's a death over a period of an hour. But actually what we're talking about is usually because of cardiac causes, and it's a cardiac arrest. And a cardiac arrest is a situation where the heart suddenly goes into an irregular fast heart rhythm, and therefore there is no pulse, there's no blood pressure, and blood circulation is stopped to the whole body, or the heart just stops beating, again resulting in no circulation to the body, a collapse of the body. The patient just becomes unconscious, has no respiration, and if help is not got, within a few minutes, the patient is dead. And that's what the sudden cardiac arrest is. And we've been hearing and being concerned about it. So you're right. It's actually there. It's on the increase. And we've heard a lot more about it in the recent times. The commonest cause of a sudden cardiac arrest is coronary artery disease, coronary artery blockages, a heart attack, or symptoms related to blockages of the arteries of the heart. And by the way, if we were to talk about what's the incidence, we in India used to have 7 lakh sudden cardiac arrests over a year, in a year. But more recently, I'm clear that this is twice that. especially post-COVID times, and we're hearing about sudden cardiac arrest, even in younger patients, as all of us have experienced, seen, and heard also.
Right. And my next question to you, Dr. Suhas Hardas, is it true that the incidence of sudden cardiac death is greater in men than in women? And if so, then why is that the case?
I think, Priyanshi, that's a very good question. Your question is whether the incidence of sudden cardiac death is more in men than in women. The answer to this question is pretty simple. Yes, it is, and it is significantly higher. The reasons why, I think there are multiple reasons. Let's look at those. First and the foremost reason is that men tend to have more adverse factors as the risk factors. For example, incidence of smoking is more. Incidence of non-smoking tobacco, like for example, chewing a tobacco or eating gudka, the incidence is much more in men. So that is a very major risk factor in men. Secondly, the dyslipidemia, that means the abnormalities of the fats in the blood are commoner in men. Third, I think until menopause, women are protected in terms of their cardiovascular problems by a hormone called estrogen. It has been also postulated, I'm not having a bias here, but it has been postulated that men are at a higher risk of mental stress, which can make an impact on their cardiovascular health. Besides this, certain substrates which are very, very common for sudden cardiac death, like for example, cardiomyopathies, hypertrophy of the ventricles. Cardiomyopathy is the disorder of the heart muscle itself. So even without blocks in the heart arteries, a person can be more prone for sudden cardiac death, and this is called as cardiomyopathy. Or increasing thickness of the heart muscle, which is called as the heart muscle hypertrophy, is commonly seen in men. So these are the reasons whereby it makes much more vulnerable for a man to have sudden cardiac death than a woman.
Right, and that brings me to my next question. Dr. Ashok Seth, what is the magnitude of this problem of sudden cardiac death, and can you prevent the sudden cardiac death cases?
The magnitude is enormous. I would say that of all the deaths due to heart attacks, the presentation itself, 10% present as sudden cardiac death, which means as immediately as a artery gets blocked and a heart attack starts. And we must remember there is a difference between heart attack and sudden cardiac death. Heart attack is when an artery gets blocked and the patient has chest pain and has time, therefore, to seek help and gets to the hospital. But 10% of those having a heart attack, their heart rhythm suddenly changes into an irregular fast heart rhythm, and that is a cardiac arrest, and the person does not survive unless immediate resuscitation, as we call it, is there. 30% or 40% of all heart attack deaths are sudden cardiac deaths over the period of a month, even after a heart attack. So they can happen a day later, they can happen 2 days later, but can happen even 30 days later, can happen 3 months later in those who are damaged hearts. So that's a huge magnitude of problem. And as I stated, irregular heart rhythms can occur not just due to heart attacks, but even weak heart muscles, even affection with a virus of the heart. And therefore, cardiac arrests post-COVID have actually increased. Heart attacks post-COVID have increased. And that's why the magnitude of the problem has increased tremendously over the past 2 to 3 years, where 7 lakh deaths used to happen due to sudden cardiac arrests in our country. Now, probably that number has doubled. It could be even more than that because we don't have the statistics. But the fact is the increased tendency for having heart attacks and sudden cardiac death has increased 2.5 to 3 times in those who've been affected by COVID. And that's been primarily due to the heart muscle being affected and the tendency for irregular heartbeats. Actually, the problem, if we were to put it in general and leave aside the COVID, is mainly due to all the risk factors which got heart disease, because 80% of sudden cardiac death are due to blockages in the arteries of the heart. It could be a heart attack, it could be just ischemia, it could be arrhythmias related to anything, but it's blockages, and therefore it's the risk factor control which prevents this. So if you see a sudden collapse in a gym, or after vigorous exercise, most likely it was a blockage. Most likely that was a heart attack, and that's what resulted in a collapse. So yes, it is a preventable problem, provided we control the risk factors and provided we also are always aware of our own risk factors, which if we control effectively, we prevent heart disease and blockages, and we prevent sudden cardiac arrest.
Right. And next, if I can come to you, Dr. Hardas, as most people still don't know the difference between a heart attack and a sudden cardiac arrest, many people may mistake recognizing the symptoms. So how do you know if it's a primary cardiac arrest?
I think that's a common confusion amongst common people, lay people. They tend to equate heart attack same as cardiac arrest. And there is actually one more term that I must add here, that is heart failure. These three are distinct entities. Like for example, heart attack is nothing but a sudden blockage in the heart artery. An artery which supplies pure blood to the heart muscle gets blocked because of an underlying block, superadded by a sudden formation of a clot. This leads to a damage to the heart muscle, and this is called as heart attack. So damage to the heart muscle due to a sudden development of blockage in the heart artery is heart attack. Cardiac arrest, whereas, is a situation where the heart stops beating effectively. One must remember that the role of the heart is to maintain circulation in the body. So it is the central pump to this circulation. When this pump will suddenly come to a standstill, or it will not beat, there will be no circulation. There will be no forward propulsion of the oxygenated blood. This is called as cardiac arrest. And heart failure is a situation where the heart muscle becomes very weak, and therefore it is unable to pump the blood at a rate which is required by the metabolizing tissues, like for example, all the organs, eyes, heart, liver, brain, kidney, etc. So sudden cardiac arrest is sudden stoppage of the heart. Heart attack is a damage to the heart muscle due to block in the heart artery, and heart failure is a weakness of the heart muscle leading to all the symptomatologies and the manifestations.
Right. And Dr. Ashok Seth, what steps should a bystander follow if he or she recognizes that someone is having a cardiac arrest before performing a CPR?
You know, it's so important for family members and even people to understand cardiopulmonary resuscitation. We've known and we've also heard of celebrities, but we've also experienced that in our own lives, where a person who we know, either at home or in a jail or somewhere, suddenly collapses. He just is feeling unwell and then collapses. And collapses with no breathing. If cardiopulmonary resuscitation by a family member or a bystander who knows how to resuscitate someone happens within the first few minutes, 50% of those lives or 30% of those lives could actually save. If nothing happens and nobody attends to those, they're not going to survive. So that's the difference that we can actually make to the public, but also to our family members. And sometimes I feel, I don't want to name this, but the celebrities who passed away, there was a singer who passed away, and he held his chest in a hotel and then just collapsed. That could have been saved by any bystander, new resuscitation, or an automatic external defibrillator, which could have been available at multiple places. So we have solutions, and we just cannot sit back and say, but it won't affect us, because it could even affect me and my family member at home, even when I'm sitting. By the way, if we talk about the sudden cardiac arrest, 70% of them happen at home. 30% of them, 20% would happen in these malls, etc., etc. It's only 10% where there is no help available. So can you believe that? That we are standing there watching people die, and not being able to save them when it's in our hands. There's a American Heart Association says saving people's lives in sudden cardiac arrest is in our hands for resuscitation.
Right. And Dr. Hardas, while we're on the subject of CPR, lack of CPR awareness is a big health challenge in India. If a bystander witnesses someone experiencing a cardiac arrest, what is the process of CPR that he or she should follow according to you?
I agree. There has been a lack of awareness, and we have been trying to bring about the awareness for the last 10 years. A lot of agencies have now joined in lately. It's a welcome change. Most important thing is to find out whether the person is in cardiac arrest or not. Whenever the person is in cardiac arrest, the first thing that happens to that victim is a loss of consciousness. So please find out if the patient is conscious or not by giving a very strong stimulus, either shout or tap on the shoulders. Call for the help is the second thing that you do. Feel for the pulse, especially in the neck on the either side of the Adam's apple. Never feel on both sides simultaneously. Feel the pulse in the neck only for about 5 to 10 seconds, not more than that. If there is no pulse, then you know that the person is in cardiac arrest. Make sure that the person is made to lie on the hard surface and not uneven surface like steps. And then you know that the cardiopulmonary resuscitation can be begun as soon as possible.
Well, doctors, thanks very much for answering those questions. We'll pause for a short break now, but we'll return with more of these important questions on the other side. Stay tuned. Welcome back to our special show, Save a Life. We have eminent cardiologists with us on the broadcast, Dr. Ashok Seth and Dr. Suhas Hardas, to answer your questions about heart diseases, CPR and cardiac arrest. Dr. Ashok Seth, if we talk about CPR a little more now, there's always a fear of a person giving CPR and them not being well trained. So are there any legal aspects of giving CPR?
There are no legal aspects of giving CPR. In fact, a bystander CPR is one of the simplest methods to learn and to execute. You must remember that a person who's collapsed in front of you, a relative, could be a relative, it could be a stranger, could be a relative when you're at home or outside with them, who's already got heart disease and has a heart attack, and etc. But it also could be in a gym. It also could be in a shopping mall. And therefore, if a person collapses, you are eligible and you're entitled and you must try and save that life. There are no medical legal issues. In fact, I agree that it should be the other way around. If you did not try and resuscitate that person, if you did not try to do anything about it, if you just stood by, then you may be actually wrong. Morally, not necessarily medical legally, but morally wrong. But to resuscitate someone with CPR is saving a life. Therefore, you morally and medically legally absolutely correct to do so and must learn CPR, which stands for cardiopulmonary resuscitation.
Right. And Dr. Hardas, to understand CPR even further, what if the person has an ICD or a pacemaker and they have a cardiac arrest? Can we perform CPR on such patients as well?
Now, what is an ICD? For the sake of audience, I must tell you that it is a shocking device. Now, what is a shocking device? You must have seen several times, even in the movies, that when a person is dying in a movie, external pads are applied to the chest and a shock is delivered. This is called as external defibrillation. Whereas in people who are very prone or at a high risk of sudden cardiac death due to certain arrhythmias of the heart, are implanted a small little device which is called as the implantable cardioverter defibrillator, that is ICD. Now this ICD delivers a very small shock in case the heart suddenly stops beating or heart fibrillates. Now this particular shock is so minuscule that a person giving a CPR from outside does not get a shock. There are rare situations where, despite having a ICD, the person may require closed cardiopulmonary resuscitation. And yes, it can be given. It can also be given in people who have permanent pacemaker implanted.
Right. And Dr. Seth, now if we talk about the importance of learning how to perform CPR, how important is it that people whose relatives suffer from a heart disease, they learn CPR?
It's extremely important. Very, very important. As I stated earlier, it's those people who actually have heart disease, who already have had heart attacks, who've got blockages in the heart artery, or have extensive risk factor for heart disease like diabetes, hypertension, smokers, with obesity. Those are the people who are prone to have sudden cardiac arrest because it's a heart attacks and blockages which cause sudden cardiac arrest. Therefore, it's utmost important that we understand how to actually resuscitate, and that's what we call CPR, if a sudden cardiac arrest happens at our home to any of our relatives who are already known to have heart disease. We must also understand that if we don't, we are the bystanders. We can save lives. It's in our hands to save a life. And we can actually make a difference because it's just those few minutes after a cardiac arrest that the patient can be revived. And if more than 10 minutes pass by, there's death. So we need to understand that we owe it to our families, owe it to our people next to each other, owe it to our society to be able to resuscitate and keep people alive. So it's utmost important that all relatives of anybody who has heart disease should know how to resuscitate, and we call it a bystander CPR, which is extremely simple to learn. It's easy to execute. And in a cardiac arrest situation, 30 to 50% people can actually live because of the relative action. In fact, not learning it. We after all say, we take care of our relatives who got heart disease by saying, अपनी tablets time पे खाओ, हर चीज ये करो, वो नहीं करना है, आपको खाना ये खाना है. We take a lot of care of them. And then when we don't know how to even resuscitate them if they had a problem, I think that would be so unfair to our families. Please, please, please.
Right. And Dr. Hardas, if I can come to you for my next question, can one fully recover after a cardiac arrest?
My answer to that is yes. And having said that, yes, I must tell you that a worthwhile survival is dependent upon three important factors. That is, what was the age at the time of cardiac arrest? How long did the cardiac arrest last? And third, importantly, were there any significant comorbidities, like, for example, other disorders and diseases which have been pre-existent in that particular person? Obviously, if the cardiac arrest lasted very long, then a meaningful survival may not be there. Patient may have significant central nervous system problems. In fact, there are situations where person lives, the heart keeps on beating, but he lives a vegetative life. And therefore, the crux of the whole matter is time. So please identify a person in cardiac arrest as soon as you can and initiate the first aid. Remember, when you give cardiopulmonary resuscitation and give closed cardiac compressions, your job is probably not to start the heart. The heart may restart or may not restart. But what is important is that when you give closed cardiac compressions, you are at least maintaining a forward flow to the brain. That is the most crucial thing. And that is, in fact, the goal of any cardiopulmonary resuscitation.
Thanks very much, doctors, for joining us on the show and answering those very important questions. We hope it helped our viewers as well. With that, it's a wrap on the show. Thanks very much for watching.